Hello, and welcome back to our Arm in Arm against COVID-19. So, Arm in Arm is a collaborative formed between many agencies, but it's in partnership with the Southern Nevada Health District. And this is the health equity section of this radio program. So the reason why I wanted to form a health equity section is because throughout all the conversations that we're having with Black communities about hypertension and diabetes and COVID and things that affect those communities, I also wanted to talk about health equity and how does that fit within all of these topics. And so today I have with me Ms. Tina Dortch from the Office of Nevada Office. I always forget to say that part because there's so many offices. The Nevada Office of Minority Health and Equity. Thank you so much for being here, Ms. Tina.
Thank you for having me, Ms. Elisa. And yes, I do manage the State's Office for Minority Health and Equity. And before I kind of get into answering your first question, I want to just thank you, Elisa, for this opportunity, for this platform, and for connecting equity to these topics. I think that that is something that we sometimes think about after the fact,
Right.
and equity should be something we think about out the gate. So
All the
thank
time.
you. Thank you. Thank you.
Yes, so my company, Minority Health Consultants, focuses on health equity. That's why it's called Minority Health Consultants, to make sure that people understand it's for the marginalized communities. It's for that work that I do is for the people who are disproportionately affected and slightly overlooked a lot of times, right? And so how does health equity fit into all of these topics that we talk about? And how do we achieve health equity so that we can end health disparities for once and for all, right?
I think that you are hitting the nail on the head, Elisa. And I want to start by saying what health equity is to me personally, because this work is a passion for me. And to me, achieving optimal levels of health and wellness for all of our underserved minority groups and that intersection of the marginalized communities that we all service in our line of work. And those intersections, they range from people who identify as racially and ethnic minorities, or someone who might even identify as a sexual orientation or gender identity demographic. We are also making sure we advocate on behalf of individuals with various ability statuses, Elisa. That's so important. But that missing piece, that sweet spot when we talk about equity, is that we have to make sure that our efforts are going to serve us in reversing those disproportionately experienced those health disparities that we're talking about and how they affect those vulnerable community members, our neighbors. Those are the people we want to make sure that as we're elevating and improving a community's wellness, we're doing so with them in mind too.
Yes, absolutely. As you talked about health equity and you gave the definition of it and you mentioned what it means to you, right? And you talked about neighbors, right? And I think that's what this whole COVID-19 is about how do we help other people? How can we be of service to others, right? And that's where health equity kind of comes in. I'm probably one of those, 60 kids, even though I'm not, where I was like, love and peace, everyone. I just want everyone to love each other. But I really think that health equity plays even into that, right?
Oh, most definitely. And I agree with you. I think you're an old soul, Elisa. And I mean that with love, love, love. I think there's nothing wrong with that because people got it.
Yes.
I think. And, looking out for our neighbors, that was part of that process. And that generation they set a good example for us. And so I work for a state agency, right? And
Yes.
so how do we do that? How do I infuse my personal passion in this bureaucratic environment? Well, I'm very fortunate in that I work in an environment that allows me a lot of leeway. Yes. And so some of the work that the Office of Minority Health and Equity does is it's about systems change. We're not out there putting shots in arms. We're not an office that does direct delivery of services.
Right.
But what we do work on is embedding health equity principles into the operations of state agencies. And not only state agencies, but some human service providing organizations. And we also work collaboratively to develop strategies to make these changes systemic. Yes. So that they can last over generations. Yes. And they don't end when I leave my job.
Exactly.
We're also about generating public awareness and education. That will never get old, right?
Yes.
Yeah, there's going to be new generations. We have to make sure this message does not leave when we leave. And then also we're partnering with those stakeholders that I mentioned, that cross all of these determining categories of health. We call them the social determinants of health.
Yes.
So you might find my office working with someone on climate change or on a housing issue. Because we know that if you are unable to find safe and secure housing, that can affect your health.
Absolutely.
So another way that we kind of do things from the office, from the pulpit of the office and that bureaucratic standpoint is that we talk about technical assistance. That's training, cultural competency training. So we do that. And then lastly, what my office has its toe in is policy.
Yes.
This last legislative session, the 81st legislative session, was very equity focused.
Yes, it was.
We had a lot of great bills come out of that session. and the office was named in a lot of them. So we're actioning and implementing a lot of work. An example being Senate Bill 390, which was about our opioid settlement monies.
Right.
We need to be aware of that in this community, that we're going to be coming into quite a bit of money. And Senate Bill 390 named NOMI, and we were able to name 7 people to an advisory committee that's going to have some input on how those dollars look and what the distribution process will be and how you prioritize needs. So we were able to make sure that community members are able to sit on that board and have a say. So that's some of the ways. That's some of the ways we're able to actually action health equity.
That's equity.
That's
right.
equity.
Getting people from the community that actually are affected or affected, right, by these topics that we're talking about. So
in
I
places
love
of power, putting them where they can affect change at the earliest stages.
Yes.
Not after. It's so much more difficult after the fact.
Can we talk about how there was not a Office of Minority Health for so long?
This is so true, Elisa. I know that the history is so stellar. It began in 2005 with individuals like Dr. Larry Gamel, and Shondell Newsom was a big stakeholder. But then there was that lull about 2014 till about 2017. And that's when the late Assemblyman Tyrone Thompson put a bill out and was able to refund the office.
Yes.
And I started in January of 2018. So that period, there were a lot of people in the community who kept the memory alive.
So I was a part of that momentum. I was a HIV director at the Las Vegas Urban League, and we used to have those meetings at the Urban League because we had a really great conference room. And late Assemblyman Tyrone Thompson got a few community members together, literally maybe 8, that wanted to come to this to help the office get back open. Me being an HIV director, of course, Office of Minority Health affects my office. It affects the work that I do. So it was a really important movement. And I just remember just those small meetings, having the state on the TV, not being able to, be in person with them because they're in Carson City, but having those conversations. And I remember that. And I remember now just seeing how far it's come. And now the Nevada Minority Health and Equity Coalition exists. They have grants coming in, and now the Office of Minority Health exists. So I'm just so excited that this is back in Nevada, that I hope that it never goes back away, because this is our NRS code, right, that we're supposed to have.
Absolutely. This is now hardwired.
Yes.
I have an advisory committee.
Yep.
Patricia Spearman, Senator Spearman, is our legislative advisor, and she's a champion for the people.
Is.
And so it positions us well.
Yeah.
So we're able to, as I said in my last statement about actions of the office, the influence on policy is so important, because from policy comes programming. Yeah. And from programming comes community level change. Yep. So it's nice to have a place at the table.
Yeah, and just some of the work that we're doing together, right?
Absolutely.
Can you talk about some of those events?
Absolutely. Thank you so much for that opportunity. And we appreciate your help so much. We're going to be having something that is part of Minority Health Month. Yeah. April is Minority Health Month. We want to say that with pride and with an action point at the end. So the office has 5 events this month. And one of the events I'll just feature is a community health worker introductory course, we kind of call it, about community health workers and their role in public health. And you are going to be our amazing moderator. You're going to bring some keynote remarks, and we're going to let the community know that this is yet another way to have access to health care. At the community level. These are people who come from their community. Yep. They get trained, and they're able to be that sometimes first introduction to a wellness check.
Absolutely.
And they help people kind of health literacy,
to
grow their health literacy. So that's one of the 5 events that we're going to be doing. And I think that we'll be able to share some more information about that through the magic of editing.
Okay. Can you tell us what date?
Yes.
Time?
I'm so sorry. That particular event is going to be April 18th, and it's from 11 to 2:30, and it's going to be a virtual event.
Okay.
Yes.
And people can go on the website and register, and we'll post that.
Absolutely. We're going to have that information so that people can join, participate, get their questions posted so we can have people like you respond.
Yes.
We're even going to have examples about how community health workers are going to be working in a faith-based setting.
Yes, we
will. So some really great conversations just so you can see it at work.
Yeah.
It's going to be really
And I'm really
fun.
excited about this. This is another one of my baby projects that I had an idea, had a brainchild, and I'm a community health worker, and I'm a community health worker instructor for the last 4 years. And I just started thinking about church settings because I grew up in church, and I started thinking about the nurses that used to be in the front row with their outfits on, right? And we knew if we fell out or if something happened, there was a nurse in the house. And I started thinking about the work that I do in community health, and why don't we have community health workers working in the church?
It's a wonderful pairing.
Yes.
It's a wonderful pairing because it also amplifies the trust factor.
Absolutely.
It exposes people who may not normally trust our health providers
Right.
for a good reason.
Yeah.
So this is the entry point.
Yeah.
And that from there, just more can happen. So I
Exactly.
think, thank you for that brainstorm, for that vision.
Well, thank you for funding the
And
idea.
I'm so glad that we were able to fund it.
Yes.
Absolutely. The fact that we can fund these things, it just does my heart good.
That's
So,
what health equity is.
Yes.
Someone has ideas from the community that will help the community. It just needs funding. That's what we've been asking for what, decades.
Yeah.
That's all that people want, is to see something that's going to reach out and help people on
I
a
agree.
bigger scale. So thank you for even finding that money to be able to fund the project. And now we're going to be working with Bishop Ron Thomas and his church, and then so
Yes.
like 8 other churches.
Yes.
And I'm so excited.
It's going to be wonderful. And then we're going to just use that as almost like a proof of concept.
Yeah.
And then it's not going to end there.
And then going back to the COVID-19 topic,
Yes.
the community health workers that we hire through this will be going out and giving home testing kits to people and tracking their progress if they get sick and things of that nature, but also being able to give them resources if they do get sick, right?
Absolutely. And 2 of the events that you will learn more about are going to be NOMI events that incorporate prevention screening and COVID test giveaways.
Okay.
So we just want to make sure that's a way that our community can stay safe, correct? We're moving through this pandemic to endemic now. We're getting out there. We're masking, not masking. Testing is going to be one of the ways we can stay safe.
Yes.
So making sure that the community health worker can instruct you on how properly to administer a self-test.
Absolutely.
Because we don't want any false positives or we don't want that or the reverse. So again, community health workers, they're amazing.
Absolutely. We are.
Hug your community health worker. If you know one, hug one.
Did you want to mention your other events?
Well, just while we have a moment, so as I mentioned, it's going to be the one on community health workers. That's April 18th. There's last night we had an amazing one about unveiling challenges that those who identify as differently able face. That was powerful last night, and we will be putting the recording for that on my website.
Okay.
Last 2 tests, or the last event will be a sexual orientation, gender identity focused topic for youth.
Nice.
What they face and the services that are available for that community and that age population.
So
what
important.
we tried to do, Elisa, is for all those marginalized communities that NOMI advocates on behalf of, there's an event for somebody.
Yes.
There's an event for everyone.
That's
So that's
good.
what the 5 events cover.
That's health equity, people.
Yes, it is.
Well, thank you so much, Tina. I really appreciate you coming out.
I will always come when you ask,
Yeah.
Elisa.
Oh, I love that. And I will always come when you ask. So thank you so much for being here and just educating us on what health equity is, what your office is doing. People need to know about your office, and that in every state there needs to be an Office of Minority Health. And if there is not, you need to talk to your legislators.
That's a great ending.